Now, in order to ensure that a particular population, regardless of how somebody is rich, regardless of how somebody is poor, or regardless of the location of the person can be able to access some basic drugs that they need for their health. The concept of essential drug program is what is actually implemented. Okay, so in essential drug program, you should just know that it's a public health initiative and is designed to ensure that what a particular population, especially a population that they don't really have that good income level, regardless of that, they have what good access to safe and effective and affordable drugs. You know, so most of the times the government brings this in, and they also subsidize the drugs, making them cheaper for a particular population to be able to access it, right? So you should know that it's built around the concept of essential medicines list, okay, where the World Health Organization is the one that actually makes the list of what drugs that are very important. Then every country builds on that, okay, thereby editing and having their own list like that. All right, so it actually identifies a core set of drugs that should always be available in adequate amounts, appropriate doses, okay, and prices should always be affordable, okay, as related to a particular people. So the World Health Organization is the one that actually champions this, okay, and it was first published. That's the first list of essential drugs. They published in 1977. So many countries, they take from that main list and they edit according to their country's needs, okay, improving on the list. So what are the main objectives of this essential drug? Is to ensure that what for a particular drug that a population will always need, it should always be available and accessible. Affordability, so the price should always be subsidized. Do you understand? So subsidies, the government pay for this, World Health Organization pay for this, sometimes NGOs pay for this to ensure that the population have it at a cheap rate. Okay. So quality assurance, of course, since it is the government bringing this, okay, since it is government collaborating with World Health Organization to bring in the drugs, the population, they are very much more, because of the trust that is built over time, they are very much more relaxed and knowing that, okay, the drugs they are taking are actually safe. So moving next, rational use of medicines. Now, because you go to the clinic, you get to interact with what a medical professional. They now get to, how will I put it? Yes, they get to know your problem and they give you just the drugs you need. So there's lower cases of drug abuse and all of that. So sustainable financing. So the people financing these programs are well established. So we are very the population, and they are very much more assured that the program could actually continue for a very long time. So it also leads to equality. So at least equality as related to health. You understand? So regardless of how someone is rich, regardless of how someone is poor, at least they should always have the basic provisions. You understand? At least for their health. You get? So basically, this is what is it, and this is what the program is all about. Okay, it's what the essential drug program is all about.